Hello everyone and welcome to the Navin Times Talk from the Heart. I hope you've all been sleeping well. If you haven't, our guest today, Dr. Vikas Punamiya. He is a pulmonologist and a sleep physician. He is here to talk to us about the importance of sleep. What is good sleep? What makes for good sleep? How do we achieve good night's sleep? How much sleep is required and everything concerned with sleep. Dr. Punamiya, hello and welcome to our show. Thank you so much for coming on our show.
Thank you very much for having me.
Dr. B, I just said that you are a pulmonologist and a sleep physician, a sleep specialist. How do the two work together, pulmonology and sleep?
So I am a medical professional with over 2 decades of experience now, having completed my medical graduation and post-graduation in pulmonary medicine in Mumbai. I trained in the UK and Australia as a part of my specialist care training. Now, as part of that training, I did a fellowship in sleep medicine from Birmingham, UK. The most rewarding aspect of sleep medicine is that vast majority of the patients, we do arrive at a very logical diagnosis and more importantly, a highly effective treatment. For this patient, this can be life-changing. Now, with there are quite a few specialities which then go on to train into sleep medicine, out of which pulmonary medicine is one of them. And because sleep disordered breathing is such a major part, it seemed to me a very logical choice to do this.
So you said you've been in this field for about 20 years?
Yes.
So doctor, you have been in this field for 20 years. Have you by any chance noticed if the amount of sleep disorders that people today are facing are much more when you started than what it is today?
I think I definitely agree with that. More importantly, I feel that the awareness is increasing more recently, and that's why people are becoming more and more aware of sleep-related issues and sleep problems. I feel we're still in a very infant stage of our sleep problems where people are not yet aware of how disruptive sleep problems are to their health and lifestyle. I think we have a long way to go. And I believe these programs will play a big part in building up this awareness.
We hope so too, because we have to notice that, people are facing a lot of problems with sleep, especially with the pandemic, doctor. The pandemic did disrupt everyone's life. It has, it still is now with the third wave and everything that's going on. It is not only just stress, I think it is also the timing, because you're working from home, we have more time, leisure time, so there's more time on our devices and that makes us sleep later, so on and so forth. So yes, it definitely is a vicious cycle. Now, every book you read, every portal you go to, the average amount of sleep that everyone claims that an average person requires varies. What, according to you, is the optimum hours of sleep that an adult requires and a child requires?
Right. So most people sleep during hours that make the most sense for their professional, family, and social lives. Their awakening times are largely determined by these responsibilities and commitments. Now, whereas they go to sleep, when they go to sleep, depends on their personal preferences and evening activities. What we need to do is try having a regular sleep schedule. Don't go to bed unless you're sleepy. But get up at the same time every day, even on weekend and during vacations. Most adults need around 7 to 9 hours of sleep. That's a given. Now, figuring out how to get that amount is another story. If you need to wake up at around 7 a.m., you can count backwards 8 hours and set a bedtime of 11 p.m. Now, for example, some people are larks, that is morning types, while others are owls, that is night lovers. And still others are between these patterns. Now, what you are will depend on your individual circadian rhythm, your 24-hour internal clock that regulates sleepiness, alertness, and various bodily functions. In other words, there's absolutely no magical one-size-fits-all schedule that suits
True,
everyone.
true, true.
The best approach is to match your sleep times to your physiological rhythms and get the 7 to 9 hours that you need regularly. But the optimal windows of opportunity are a bedtime which starts between 8 p.m. to 12 a.m.
All right. So, would you recommend that we sleep every day at the same time, so then the body sort of gets used to it? Do you think that?
Exactly. Absolutely.
So that is sort of cultivating a habit. So once you start cultivating that habit, it becomes something that we do every day, and body then, like you said about the body clock, it gets used to it, and we start sleeping or at the same time.
Very true.
In your opinion, like you said, everybody is so different. Everyone's biological clock is so different. But how long approximately would it take for a person, for example, my sleeping time is anywhere from 11 to 1. So
Right.
if I want to cultivate this habit, how long would it take me approximately to get used to it, to get into the grind and say, every day it's going to be about 11 o'clock. So I go to bed at 10:30, hoping a sleep comes, which rarely does happen. Would it take about a week or 10 days or 2 weeks in your
Yes.
expert opinion?
Getting a routine in place can take some time. It can take a week for some people and even 2 weeks for some people. It's just a matter of being persistent and trying to keep to those routines, which is very important. It is just a matter of breaking a bad habit, and forming a good one. So, but you need to persevere. That is the most important thing.
Right. So what happens if you go, let's take my example. I want to go to bed and I say 11 o'clock is what I need to. After this interview, I'm convinced that I should be sleeping at the same time every day. So at 11 o'clock, at 10:30, I go to bed saying I'm going to go to sleep at 11. But
Yes.
sleep doesn't come. Is there anything that I can do to make myself fall asleep or something like that?
We can do to make sure that we get proper sleep when we have to. Make sure that we keep our electronic devices off by at least an hour before we go to bed. Having a hot water bath 2 hours prior to sleep is very helpful because it helps relax your muscles. And as the body cools, it sleeps much better. So there are small making sure also. So say you go to bed and after 20 minutes you realize you're not getting sleep. It's no point tossing and turning in bed, get out of bed, probably stretch, do a bit of stretching, probably read a dull book, or just take a walk in the house and then try and go back to bed, because when you're just tossing and turning, you're more likely to just fight the sleep because you're only thinking hard how to sleep.
Exactly. Very
Rest.
true. Yes, it happens.
This-
It happens so often with all of us, I'm sure. So you said that reading is a good thing, but the key
But
word
when-
that I just heard you say is a dull book.
And a dull book, yes, and no electronic devices. Very
Right.
important.
Right. So would you say that sleeping longer is better for our health? So instead of 7 hours, I sleep for 9 hours. Is that okay?
So, as with everything else, nothing in excess is ever good, as is for sleep. Okay. Now, for most adults, getting 7 to 9 hours of sleep in a night is ideal. Anywhere between 7 and 9. Okay, the average being 8. There are a small percentage of people who may need actually around 10 hours, but most adults who sleep for more than the recommended amount may indicate an underlying health issue. In addition, sleeping more may actually increase your risk of obesity, headaches, back pains, and heart disease. A recent study of oversleeping actually discovered that body is at risk for metabolic issues like diabetes, blood pressure, and dyslipidemia. So, no, I don't believe that sleeping more than 9 hours is helpful. Yes, you can sleep anywhere between 7 and 9 hours is good, and maintaining that routine regularly is very important.
You know, you have just demystified something, because we always thought that the more you sleep, the better it is for your body. Because while we are sleeping, this is what we have learned, this is what we have been told, that while you're sleeping, the body repairs itself, and you know, the cells are also getting renewed. Now you are saying that if we oversleep, it causes a problem. And how is diabetes and heart problems, doctor, how is that related to oversleeping?
So when we are oversleeping, the studies are still ongoing. A lot of research is going on about how these impact. But what is thought is when we are oversleeping, the body is becoming more and more sluggish. You know, you're spending more time in bed. That means you're doing less to exercise, less to be up and around, and all those lead to increased problems like obesity, which is one of them, and it also increase hunger, which again increases your obesity, and obesity is one of the major causes for all of these other metabolic issues like diabetes and blood pressure.
Right. And so you spoke about too much of sleep. Now tell us, what happens when there is lack of sleep? We are, instead of sleeping the 7 hours, we are sleeping 4 hours and 5 hours, or we are sleeping the 7 hours, but our sleep is very disturbed. So in total, we are actually sleeping maybe 5 or 5.5 hours. So when there is lack of sleep, besides being tired when you wake up in the morning, what else happens?
Right. This is one of my favorite topics to discuss. I say, sleep, you don't snooze, you lose. Quality sleep is essential for good health and overall quality of life. Okay. Sleep allows your body and mind to recharge, leaving you refreshed, alert when you wake up. Now, chronic sleep deprivation, it is a bane of our modern world and an alarmingly increasing public health problem. Recent studies in the US actually showed that 1 in 3 Americans are sleeping less than 7 hours per night. That is around 37%. For decades, our employers have equated good work output with employees putting in long hours at work, not realizing how counterproductive this is. Perhaps the reason why coffee is the second most widely sold global commodity after oil, because employees worldwide work long hours, surviving on large cups of coffee, and often operating 5 or 6 hours of sleep a night. There's a culture of work hard, party harder, which has also evolved. And the obvious loser in this cycle of life is your sleep. The sad truth that is that sleep deprivation is an issue too often ignored, even when sleep curtailment is associated with an increase in industrial accidents, motor vehicle accidents, medical and occupational errors. Research from Harvard University actually demonstrates that it is challenging to find any other condition that has a greater impact on productivity than sleep deprivation. In our hyper-connected 24/7 world, sleep has somehow become devalued. And the fact is that the average amount of sleep we are getting in our modern world is steadily decreasing.
You have said so much about it. So besides the accidents that happen, and you know, we're feeling tired, can you also tell us anything else that happens with sleep deprivation? Like, you're right, doctor, when you said, you know, employers want their employees to work more. They want, you know, maximum and optimum output from them to please the employers. People are putting in that because that is what is expected, doctor. So
Yes.
they don't realize it. Like, I know for a fact that you know, when I was younger, I could function with less amount of sleep. Today, my sleep is very important to me. I really guard it as much as I can, because I know the next day when I am not, you know, I haven't slept well, I'm very irritable. First and foremost, I'm very, very irritable. Secondly, I feel I cannot function clearly. It's you know, I find maybe my judgments are not very clear as they should be. These are a few of the things that these are my personal experiences. But otherwise, what else happens, doctor?
So without enough sleep, the brain cannot function properly. This will impair your abilities to concentrate, think clearly, and process memories, just as you just mentioned right now. And
Right.
insufficient amount of sleep also has serious repercussions where it leaves you vulnerable to attention lapses, reduced cognition, delayed reactions, mood shifts. Lack of sleep also, as I already mentioned, is a higher risk for medical diseases like obesity, type 2 diabetes, high blood pressure, heart disease, and poor mental health, and even sometimes early death. A very sensitive issue concerning lack of sleep is the reduced male testosterone level and a lower sperm count with reduced sex drive and impotency, which affects fertility, leading to conception issues as well.
So is this only restricted to men, the fertility issues that you're speaking about, or women
No,
too, because of lack of sleep, get affected?
even women as well.
Okay. Now, what happens? Suppose I am working a 5 day a week, and well, the concept is not entirely in our country. I mean, we are working towards it. I hope it happens. But I'm working 5 days a week. I work 12 to 14 hours, maybe. I'm just saying.
Right.
So weekends are the days that I can sleep. Weekends are the days I can chill, I can relax, I can party. Can I make up for that lost sleep that I missed during the week? Because the week is very, very busy. So can I make up for that during the weekend? Is it possible?
So sleeping in on weekends to catch up on sleep is a very common approach. Okay. Unfortunately, it is not clear if sleeping in compensates for the sleep debt or it simply represents a return to our normal sleep patterns. A concern for both napping and sleeping in on weekends is when you're underslept, a little extra rest can give you a false sense of recovery. You may feel better for a while getting extra sleep, but the snowballing effects of sleep loss is a debt that takes much longer to repay, like most people's bank loans.
Right.
While sleeping in for a morning or two may help, it's often not enough. Research has actually shown that it takes up to 4 days to recover just 1 hour of lost sleep and up to 9 days to eliminate sleep debt. A
Could you
full
could you please
recovery.
excuse me, doctor? Could you repeat this part where you said it takes 4 hours to compensate for 1 hour? I mean, 4 days to compensate for that 1 hour of sleep.
So research has shown that it can take up to 4 days of proper sleep to recover from just 1 hour of lost sleep, and up to 9 days to eliminate the sleep debt. So full recovery from sleep debt actually returns our body to its baseline, reducing the risks which are associated with sleep loss. Now, while napping isn't a replacement of lost sleep, it can help you feel more rested during the day. Naps may be very helpful, especially for people who are shift workers or people who maintain an inconsistent sleep schedule. Even a short power nap can refresh the rest of your day. If you take a nap, please keep it brief. Nap for less than an hour and before 3 p.m. preferably.
So why is this before 3 p.m.? Now in Goa, we are a people who love the afternoon siesta. Many of us. I'm for sure. I am. So we do like to take a little nap in the afternoon. You have said before 3 p.m. Why is this before 3 p.m.? What is the
Reason being,
significance of that, doctor?
reason being that when you sleep longer or later during the afternoon or evenings, it is going to impact on the sleep that you get at night. So when you try to go to bed, usually if you are going to bed at 10:30 or 11, it is unlikely that you're going to be able to sleep immediately at that time because you've already rested earlier in the day. And because of that, it will tend to push your sleep time further down. So, which is why I always recommend that it should, if you have to take a nap, try and take it earlier during the day, which should be before 3, and try it not to be more than 45 minutes at a time.
But you would recommend an afternoon nap, would you?
It, So I recommend an afternoon nap for people who need it. So people who find it difficult to function during the day, a short power nap definitely works well. And this is very, very helpful for people who are unable to maintain that sleep schedule as we want them to. or even for shift workers, as I said.
Okay. And we have been speaking about, the adverse effects of sleep. Can you tell
Yes.
us some of the common sleep disorders? Recently, I was watching was watching a program, and I saw this person is sitting and speaking with people, and while he's speaking to people, he just falls off asleep.
Yes.
So, of course, this is an extreme, I'm sure, condition. But what are some common conditions that are there, doctor, in sleep disorders?
So, sleep medicine is such a broad and multidisciplinary field. It encompasses a broad number of disorders. Mostly, what I encounter is either what you just described is a patient having excessive daytime sleepiness, which is either most likely due to sleep apnea or insomnia, uh, or even restless legs. The other very common, and I'll touch on that a bit later. The other commonest sleep disorder that I actually face is poor sleep hygiene, and that's
What
probably
is
one of the
what
most
is that,
common.
doctor? Can you
So
please elaborate?
it's very, very bad sleeping habits. So where as we said that so poor sleep hygiene is basically using your electronic devices till you go, or rather in bed. It is about having no regular sleep time, probably some days sleeping at 11, some days sleeping at 1. So there's a very big irregularity in your sleep times. So these all part and parcel of your sleep hygiene, getting your work into bed. So these are part and parcel of your sleep. Having a television in the bedroom, which I believe is one of the biggest curse you can have. So these are all part and parcel of very poor sleep hygiene and which need to be worked on.
So the sleep disorders that you have just mentioned are insomnia, sleep apnea, and something about the leg. I'm
Restless
sorry, I miss restless leg.
leg
So
syndrome.
can you take us through the three of them, please, so we understand what it is, and maybe we can identify if any of us are having any of these conditions.
Sure. So insomnia is a sleep disorder which affects
Yes.
almost 35% of adults. It is marked by problems where you're having problems getting to sleep, staying asleep, or even for sleeping as long as you like in the morning. Okay. It can have serious effects leading to excessive daytime sleepiness, a high risk of auto accidents, widespread health effects from sleep deprivation. Common causes are usually stress and irregular sleep schedule, poor sleeping habits, mental health disorders like anxiety, depression, even physical illnesses and pain, chronic pain, medications, neurological problems, and specific sleep disorders. Just the thoughts about the sleep problem. What if I don't fall asleep tonight? And behaviors which develop around the sleep problem, like sleeping in, napping, ruminating in bed, tend to prolong the insomnia symptoms. For many
Right.
people, a combination of these factors can initiate and exacerbate the insomnia. Uh, People, other than that, we spoke about sleep apnea. Sleep apnea occurs in almost 25% of men and nearly 10% of women, as per studies from the US. It's probably one of the most under-recognized medical disorder in our country due to poor awareness. It can affect children and adults, including people of both sexes, though it does occur more commonly in males and those who are overweight. It is marked basically by abnormal breathing during sleep. So people with sleep apnea, they have multiple extended pauses in breath when they sleep. These temporary breathing lapses, they cause lower quality of sleep and affect the body's supply of oxygen, leading to potentially serious health consequences. Sleep apnea is an independent risk factor for high blood pressure. It is associated with cardiovascular disease and abnormal glucose metabolism. It obviously also is related to sleepiness related road traffic, work related domestic accidents, and this all increases our illness and death in the general population. Patients with sleep apnea commonly present with excessive daytime sleepiness, loud antisocial snoring, mouth breathing, irritability, a loss of focus, forgetfulness. They also present with what I mentioned as restless legs. So basically, you tend to get cramps when you're sleeping at night, all of a sudden, and you need to beat your legs on the bed just to get some relief. These are all precursors of sleep apnea itself.
So you said that you get cramps in your legs. How
Yes.
does that happen, doctor? What leads to it, or what are people
Uh,
doing that causes that problem?
so sleep apnea is a major cause of restless leg syndrome. That is basically because the oxygen levels are dropping during the night when you're breathing. So basically, what is happening is you're breathing in some of your muscles, all the muscles in our body relax. And in some people, these muscles tend to flop over each other, cutting off the airway, and the air entry is stopped. Because of that, the amount of oxygen that is going to all the tissues reduces. And one of those effects is restless legs. There are obviously multiple other effects as well. The most important being that the brain doesn't get oxygen, and the brain tries to wake you up, arouse you from a lighter sleep to a from a deeper sleep to a lighter sleep, and which will help enable the muscles to contract again, the air to flow through again, and things to normalize. But when this keeps occurring again and again through the night, people have reduction in their oxygen levels and sleep fragmentation as well. We have patients who almost sometimes stop breathing around 35 to 45 times per night. Per hour per night.
My
So on an
goodness.
average per hour, their breathing stops almost 35 to 45 times, and each episode can last from 10 seconds to even 2 minutes.
Right, doctor. That's a lot of information, and I'm sure those who are having problems are now able to identify uh, their problems from the symptoms that you've mentioned. Let's take a short break, doctor, and this is for all of you who are watching. Let's take a short break. We are speaking with Dr. Vikas Punamiya, and we will start and resume after the break. Thank you. Hello, everyone, and welcome back. We are with Dr. Vikas Punamiya, a sleep physician and a pulmonologist. He has been giving us a lot of information about sleep and everything related to sleep. So, doctor, we are back. And my next question to you is, what causes sleep disorders? You have told us about, just a recap for those who are joining back again or who are just joining. We've spoken about sleep apnea, we've spoken about restless leg syndrome, as well as insomnia. So, doctor, some of the common causes for these conditions.
So sleep problems are caused by various factors. Okay, although the causes may differ, the end result is disruption of the body's natural cycle of slumber and daytime wakefulness. Now, common factors which cause any sleep disorder or anything which disrupts your sleep could be physical, which could be pain or chronic pain. It could be medical, like having asthma, and asthmatics tend to get attacks at night. It could be psychological, like depression or anxiety disorders. It could even be social, such as having alcohol, which is usually people tend to have pretty late into the night. The one thing about alcohol that I wanted to actually mention over here is a lot of people think that after I drink alcohol, I sleep very well. It is not actually true, because alcohol may help you sleep quick. It may help you go off to sleep. It may cut off the time required to go off to sleep. But what it does hamper is the quality of your sleep. So it definitely worsens the quality of your sleep. And it is very, very bad, especially for people who have sleep apnea, because it tends to relax the muscles even further and causes increased episodes of sleep apnea. Coming back to the causes, working night shifts. This work schedule, it messes up the biological clocks, and that disrupts sleep. Genetics. There is a disorder which we haven't spoken about, and we don't very commonly, we're not commonly seen much here, is narcolepsy, which is a genetic disorder. We saw it much more commonly in the UK, and I think it's also more common in the Western world. It probably may be under-recognized here, but definitely we don't see that many cases. Medications, which also may interfere with our sleep. Also, as we age, most people have some sort of medical disorder, and that may itself cause sleep disorders. It may be a normal part, and as we age, our amount of sleep reduces for most of our elderly population. And we don't know as yet whether that is just a normal part of aging or sometimes a result of the polypharmacy that elderly people commonly use. They're on multiple medications, you know.
True.
So I think there are various causes, as I said, for having sleep disruption. But what is true is sleep gets disrupted and leads to major other issues.
Absolutely. So, doctor, what according to you are or is the most common reason for sleep disorders? You've given us an entire list of it, but in your opinion, you are treating so many patients. What is it today that causes the problems?
So during the current pandemic, over the last 2 years, practically all of us have had our sleep patterns disrupted. Whether it is the
Absolutely.
frontline workers, whether it is the frontline workers or the professionals working from home, or even our traditional homemakers, and of course our children who have lost the social structure of school and are significantly affected. Pandemic related uncertainty, economic stress, familial stress, they all impact our sleep. The commonest problems that we see with are insomnia, with either an inability to sleep or maintain sleep, increasing with their sleep screen time, and also oversleeping, which makes them groggy, irritable, and unfocused throughout the day. Having said this, I still believe that one of the major problems in our country is still obstructive sleep apnea, which is very, very under recognized, and it does not get the due attention that it deserves. Um, a lot of people tend to stop breathing, and especially with the pandemic, where people have had weight gains and obesity being a major problem, I think the incidence of sleep apnea is also increasing. Patients tend to stop breathing in their sleep, and this obviously percolates into various other medical issues and problems.
So, how do I recognize? Like, is there any test that I need to do? Like today, most of us want to go to Dr. Google and find out if we have a situation or not, But how do I recognize I have a problem? When is it time for me to make that, important call and say, no, I need to go to an actual doctor besides Dr. Google and find out what is the problem? When should I do that?
So, you may have a sleep disorder if you experience any one or more of the following symptoms. If you're regularly having difficulty getting sleep or staying asleep over a period of, say, 3 weeks or more. If you're feeling so tired that you wake up in the morning and you cannot function normally throughout the day. If you have a problem of snoring. And snoring, when I say, it means the loud variety which keeps your partner awake. I'll tell you the story. My two aunts, when I was very small, and I had two aunts. They used my grandfather's sisters. They used to be huge snorers, and believe me, we used to call them. One was a lion wala bhua, So literally, like her snoring was like a lion, and you could no way sleep in the same room. Uh, Today, I recognize that in most likelihood, this is a lady who must have had sleep apnea. And she unfortunately was never recognized in those times. That problem was never recognized in those times. And she had heart issues, she had diabetes, she had blood pressure, and she died of heart disease at a very young age. So, which is why I believe that, and snoring, we all snore, a little bit of snoring is very common. That does not mean any reason to get alarmed. But yes, when you have snoring which is really loud enough to sometimes disturb not just your partner, but sometimes even to be heard outside the room, that is something that really needs to be looked into. The other things that are there are falling asleep at the wheel while driving, or even when stopped for a few minutes at traffic light, if you nod off, that is another very alarming symptom.
When very
Struggling.
dangerous, doctor, more than alarming, I think it's, so dangerous, not only for the person, but even for others on the road.
Exactly, and that reminds me of an incident which happened in New York. Actually, it was a major incident. I can't remember the year, probably '96. I'm not sure, but it was a major metro accident. It was the first metro accident in New York, and later on, it was found. Basically, the driver took a turn at 3 times the speed that he was supposed to, and which resulted in a big derailment, and I think around more than 60 people died in that accident. It was later found that the driver had nodded off because he was known to have unrecognized sleep apnea. And sleep apnea now in these countries, in the Western world, it is imperative that people are evaluated for sleep apnea before they are even given license for public driving, which unfortunately still is not seen in our country. And especially with the number of truck drivers driving and all, I think it's very, very important that such a thing be put in place. Struggling to stay awake when inactive, like you're watching television or reading, if on most days you're struggling to stay awake, then that is something of an it's a alarming thing. You should need to evaluate. Often being told by others that you look sleepy, having difficulty with your memory, having slowed responses, being unfocused, being more irritable, and needing to take naps almost every day. These are all symptoms which should sort of make you think that you may probably need an evaluation with a sleep specialist. Okay, at least an evaluation. It may not necessarily. It may, and believe me, majority of our problems are only just corrected by correcting sleep hygiene, poor sleep habits. If we are able to do that, that will sort most of the problems. But there are quite a few people who do have sleep disorders, such as sleep apnea, which we need to address and find out. The way that we normally do that is usually what is very important is to when you come to a sleep specialist especially, so what we do is we take a very elaborate history, and the history would be about your medical history, your symptoms, and as well as your sleep history. Okay, and that is the crux of recognizing sleep problems. Um, After that, your doctor may decide that you may need a sleep study. And a sleep study basically is what we call as a polysomnography. And there are two varieties in our country which are normally practiced. One is in a lab like we do, which is a much more comprehensive study, which is almost a 68-channel study. It is video recorded, so it looks for sleep moments during sleep and things like that.
So
Basically,
may I just interrupt? So you said you record a person sleeping. Is that what you're saying?
So
Wow.
basically, what happens is the person comes in at night, and the technician will first put leads. The leads go on their head,
And the
uh,
chest?
they, I'll tell you. So
Yeah.
on their head, on their near the eyelids, at the chin, there's a band around your chest, and your tummy. There's a ECG leads, there's a leads for your saturation, and there's a cannula at the nostril for the flow. So basically, what we're checking is basically the sleep waves, the ocular movements, that is the eye movements, the chin movements, that is the muscle movements, and your respiratory and your abdominal movements, your breathing pattern, your oxygen level. All this is monitored. That data over the night is collected and evaluated and analyzed, and that gives us an in-depth information of whether you may have sleep apnea or any other medical issue, any other sleep related issue, you know. Now, as I said, we do these at our lab, which is a comprehensive study and video recorded, but these can be done at home as well in what are known as home studies, which are less comprehensive, around 21 channel studies, and where the technician comes home, explains to you how to put the leads, and then once you're done with your night's sleep, in the morning comes and collects it to analyze the data from the information gathered. How we try to go about finding out about sleep and sleep disorders, and about who needs to start looking at probably getting people to come to the sleep specialist. One of the most important thing regarding sleep disorders, I believe, and it is imperative that all sleep physicians who are key pillars of healthcare in our country, they should spend at least a couple of minutes asking their regular patients about their sleep and any effects wherein, you know. Sleep disorders can be treated very differently. Like insomnia benefits from counseling to changing habits while sparingly using sleeping aids. That's the other problem that I have with most people, is popping night pills, you know, sleeping pills.
I was just
And
coming to that, because normally when you go to any doctor and this is generally, I am saying generally, so when we go to a doctor and you tell them that I'm having difficulty sleeping, they do generally prescribe a mild sedative. So
yes.
I think we are sort of becoming used to that as well, popping a pill to get some sleep.
I'm very, very against the idea of giving sleeping medication unless you're absolutely requiring it. So I think that's why it is very important to first know what the problem is, why the problem is, why a person is not sleeping well. If someone's not sleeping well just because of poor sleep hygiene, it is better to help them change their habits rather than giving them sleeping pills, which are going to be a long-term habit, and they will ultimately develop a tolerance to these tablets, you know, and these will not work for them. The other issue is sleep apnea. Sleep apnea is worsened when you give sleeping tablets. Just like alcohol, it makes your muscles relax more and causes worsening sleep apnea. So, which is why I plead to everyone that please do not pop sleeping pills like mints. You know, you need to first get your sleep evaluated, try and get to the bottom of the sleep problem, and only then, under appropriate guidance, take a sleeping pill if absolutely indicated.
Right. Doctor, for someone, because I think this is a very, very common problem, is snoring. Like you spoke about your aunt, and you said lion. We have, I remember I have worse names for some of my relatives who, when they snore, the apartment actually resonates with it. You can actually feel it. So, can you give us one tip, one trick that we can do to avoid? Is there anything like that? Because I'm sure many of us, would benefit from it for sure. So,
unfortunately, Maria, there's no tip to stopping snoring. So I'll tell you why snoring actually occurs. So snoring is a big medical problem. When we sleep, as I said, all the muscles in our body relax, and so do the neck muscles. Now, in some cases, these muscles tend to flop over to an extent that the airway gets narrowed. but does not completely close. Now, the air which is passing through these narrow airways is causing a lot of vibration, and that vibration is transmitted as the sound that we recognize as snoring. The narrower the airway, the louder the snoring. Okay, so if you're having people where you feel that the snoring is so loud, they definitely need medical intervention from a sleep specialist, because they need their evaluation. Because in most of these patients, snoring will not be the only problem. They will always also have sleep apnea, and which is why it is very, very important to recognize this.
Right. We have got so much of information, and I'm sure all our viewers watching will now be able to hopefully sleep better. And to add to that, can you give us a few tips on how we can improve our sleep hygiene, how we can sleep longer and deeper?
Sure. I think, as I first mentioned at the very beginning, be regular with your sleep habits. What you should probably do is budget at least 30 minutes before you wind down to sleep. Basically, you can use calming music or meditation, a light stretching, reading, and or any relaxation exercise that you feel is comfortable for you. Make sure you don't do any heavy exercise during the late hours of evening, because that tends to stimulate the body. Okay. Getting daylight exposure, that is one of the especially in these pandemic times, it is very important. Believe me, I feel most of the elderly are suffering basically because they've not even been able to step out of the house because of that fear. And it is very important that they get at least half an hour to an hour of sunlight, because this is a key driver of circadian rhythms, which encourage quality sleep. And from electronics, I cannot say enough about it. Stay away from all.
I feel so guilty listening to you. My goodness me. All right, please go ahead.
I've been guilty long.
Yes.
Electronic backlit devices have to be stopped at least for an hour prior to your bedtime. Dim your lights. People don't recognize, but LED, most of our houses now have LED lights. LED light is almost as good as what daylight is, So it hampers the production of melatonin, which the body creates to facilitate sleep. So it is very, very important to make sure you have dim lights in the room. The best night light, if you have to have, is a red light rather than any other color. Okay. That does not impact the sleep waves. Stop smoking, avoid alcohol at night time, and caffeine. Caffeine at least 6 hours prior to bedtime. Avoid dining late or any heavy meals at night. One of the very important thing is taking a hot water bath at least 2 hours before bedtime. As I said, the hot water tends to relax our muscles while the body sleeps better as it cools down. Don't toss and turn. It helps to have a healthy mental connection between being in bed and actually being asleep. For that reason, if after 20 minutes you haven't gotten sleep, get up and stretch, read, do something that is calming in the low light to try and fall asleep again. Okay? Avoid using your bed for work. Bed is only for two things: sleep and intimacy. To achieve these goals of a better sleep, the most important aspect is support from your family and your friends. Man is a social animal. His survival is determined by his interactions with his fellow beings, So let's make better sleep our New Year resolution for this year and work towards achieving the same. Remember, quality sleep leads to a sound mind, leading to a happy life. Thank you.
Thank you, doctor. And I think that sleep resolution should not be just for this year. I think it should be for every year of our lives, because like doctor has explained, sleep is very, very crucial for our general well-being. And if you sleep well, you wake up healthier. Thank you, doctor, for all the information that you've given us and the tips. And we definitely, hopefully, we all should be applying what you have said. So yes, and to all of you who are watching, thank you so much for joining us for your time, for your patience. And until next time, do take care of yourself. From all of us here, thank you and bye-bye.